Friends, I am Dr. Phos. Welcome to my channel, Dr. Phos Presents. Tissue Salt Therapy, Part 25, Califos 1. Full name Kalium phosphorica or Kalium phosphoricum. Short name Califos. Chemical name Potassium Phosphate. Dr. George W. Carey, one of the topmost tissue salt therapists of the world, remarked about the Califos, the day when physicians fully realized the nature and functions of Califos, thence onward there would be no need of asylum for the insane in the world. Mode of action: the grey matter of the brain is fully controlled by inorganic salt potassium phosphate. Principally, this salt combining with albumin and oxygen makes grey matter and cerebrospinal fluid. So any illness arising out of deformed or want of cerebrospinal fluid and grey matter is curable by Califos. The whole mode of action has been demonstrated in this simple picture. Califos, this is brain matter. The whole brain matter, it is inflamed or in diseased. Califos makes it normal. If you can remember this particular paragraph, the spirit of potassium phosphate, or rather Kalium phosphorica, will be set in your mind forever. Califos for mental symptoms: brain fag going to high mental work, depressed mind, restless, excitable and impatient, furiousness, whining, irritability, cries, fearsomeness, nimini, pimini, want of memory of children, mania, hysteria, most mournfulness, depression, excessive shyness and involuntary long exhalation of lying in women, lost in past sorrowful event, homesickness, anxiety and worry of workplace, heaviness of family events, lamentation, delirium, somnambulism and sleepwalking. All this type of some mental aberrations are covered by Califos. See, everything last. I will just refer to last point, somnambulism or sleepwalking. Somnambulism is actually a very peculiar ailments where the patients get up from bed during sleep and walks around the place around the room or house and again come back to start sleeping. This is sleepwalking, and this is anybody may not follow this, or they cannot understand how this is possible, but it is possible. And there are few medicines for this somnambulism. In this particular Califos is one of the medicines there. Califos for ailments of head. Headache of nervous patients, cannot tolerate din and bustles, go to madness at trifles, perplexed, inability to think, very much tired, repeated yawning, stretching of limbs. Hysteria, neuralgic headache with ringing in ears, feeling good in humorous excitement, but problems when alone. Lachrymose mood, tired feeling with pain and heaviness in the back of head. Students' headache owing to too much mental pressure or lack of sleep. Vertigo due to weakness or from lack of sleep. The images below are just what have been discussed in the above paragraph. A few images of that given here. Eye symptoms of Califos: vacant look after a disease, pupils dilated, ptosis due to weakness of ocular muscles, squint-eyed after an attack with diphtheria. Ear symptoms of Califos: hard of hearing from cochlear nerve affection, humming, buzzing in ears, ulceration of tympanic membrane, otitis media, itching in auditory canal, oozing of very obnoxious bloody fluid from ear, hard of hearing due to weird sound in ear. Now let us discuss the pictures. This is dilated pupils. The pupil
is not is seriously dilated here. You see, it is not the normal people. This is dilation of pupil. It occurs due to nerve affection of eye. Ptosis means drooping down of eyelid. This is also nerve and muscle affection. Squint eye when the two eyes are not in order in the normal way. The person cannot concentrate his line of vision on a particular object. This is squint. This is due to diphtheria infection. This boy was normal light, was no, his eyes were normal, but after diphtheric attack he has got squint eye. All these will be addressed by Phos. Now here, this is mid layer. You see, this is the mid layer. This is tympanic membrane. Mid layer, we know there are three small bones, malleus, incus, stapes. Then there is empty chamber, which is connected to the throat with the help of this auditory canal or eustachian canal. When this mid layer is inflamed, it is called otitis media. This is otitis media. This is otitis media. When otitis media is there, the whole middle ear is full of inflammatory fluid. Then what happens? This membrane is ruptured and this fluid comes out here along the eardrum to external ear and outside. Or some portion of it may go to throat also. And this is the picture of tympanic membrane when viewed through the otoscope. This is otoscope. With the help of otoscope, the doctors can see ear, internal ear up to the level of ear tympanic membrane. Because tympanic membrane is a guard. You cannot see beyond this. So this is the view of tympanic membrane with the help of otoscope. This is normal view. This is when there is slight infection. Some fluid is there, and this is effusion. The whole tympanic membrane, I mean the whole of middle ear is flooded with effusion. Effusion means inflammatory fluid. Nose symptoms of Phos. Various foul smelling exudation from nose and sinus. Ozina, degenerative disease of nasal mucus and nasal bone with crusting, purulent discharge, halitosis. Halitosis means bad smell from the mouth or nose. Sneezing from little exposure. Easy bleeding from nose, epistaxis. Blood thin, blackish. Does not coagulate easily. Thick mucus hocked from posterior nares. Now, just a few images and explanation. This is ozina. Ozina means actually destruction of the nasal structure. Nasal mucous membrane, nasal bone, everything is degeneration. And there is very obnoxious foul smelling exudation comes out from nose. This is a very dangerous disease. It occurs due to various types of infection, particularly bacterial infection, severe bacterial infection. Of course, there is some constitutional dyscrasia. If there is no constitutional dyscrasia, such deep disease cannot occur in a person. So, ozina is a very bad type of disease. The whole nose is destructed. Sometimes the structure, the nose becomes saddle shaped and the internal structure is completely destroyed. And symptoms are this purulent discharge, halitosis, sneezing, crusting, etc. Next, face symptoms and another thing. Posterior nares. What is posterior nares? Posterior nares, this is the picture of posterior nares. Mind it, this is our nose. This is external opening of the nose. External opening is the nose is called internal or the anterior nares. Nares means opening of the nose, and the nose in the internal aspect is open to mouth. I mean open to the throat. That is called posterior nares. That is back portion of nose is connected with the throat. That is posterior nares. When we just in this way draw air through nose, the sound appears and mucus from this place comes down to a throat. This is called posterior nares. Face symptoms of Phos. Facial neuralgia, especially right-sided, better from cold application. Great exhaustion after attack. That is, after attack of neuralgia, patient become greatly exhausted. Neuralgic stitches in the maxilla.
maxilla bone, better from eating. Maxilla actually this is the area of maxilla, this area, both side maxilla. Better from eating, speaking, touch. Face pale, very sickly, with eyes deeply set in sockets. This is sunken face. Dark circle around eyes. Contortions from weak facial muscles. The facial muscles become weak. As such, the face is distorted. The distorted face is called contortions. With this video ends. If there is any trouble you felt during reading and viewing, please write down in the comments. I will certainly respond. Thanks for listening and viewing.